Kasalukuyang nagbibigay ng update ang DOH sa 2019 novel coronavirus.
Narito po at panoorin natin.
Has issued a temporary travel ban covering all travelers from Hubei province of China. The DOH will also be recommending the expansion of the travel ban coverage to more Chinese provinces as new information on the increasing number of cases per region arises. In the Philippines, the DOH would like to report that there are no additional patients under investigation as of today. So yung PUIs natin, as of today, remains to be a total of 29. 23 of the PUIs are currently admitted and isolated, including, of course, the positive case. 5 have been discharged but are still under strict monitoring, and we have one mortality, as you all know. The DOH is assuring the public that the first confirmed case is isolated and being properly treated, and that contact tracing is already being conducted in coordination with the Bureau of Quarantine, the Epidemiology Bureau, and other government agencies. Stricter infection control measures are also being implemented in our hospitals with PUIs both for patients and health workers. With this declaration comes the need to be more vigilant, and we continue to urge everyone to practice precautionary measures, such as observing proper hygiene, following proper cough etiquette, avoiding crowding places, eating nutritious food, and hydrating oneself. For our health workers, we strongly advise you to wear protective personal equipment, such as our disposable face masks, gowns, and gloves, when in contact with the patient, especially their blood, body fluids, or secretions, in keeping with the prevailing hospital protocols. We also remind our health staff to ensure proper disposal of hospital waste. And we urge everybody to wash hospital laundry thoroughly to boost their immunity, and of course taking care of themselves and monitoring themselves for signs and symptoms. Because the safety of our health workers is paramount to the Department of Health. And yes, Dr. Abilino, at this point I'd like to give the floor to Dr. Rabi.
Thank you very much. So there was a lot of anticipation on the outcome of the Emergency Committee for International Health Regulations in regards to the outbreak of the 2019 novel coronavirus disease. So the committee met yesterday, and the committee was presented with updated information to better understand the transmission of the disease, the number of cases, the number of deaths, and what we know about how the disease is transmitted. Taking this information into careful consideration and recognizing that still the majority of cases are within the People's Republic of China, but acknowledging that cases have already been confirmed in approximately 18 countries, and there is clear person-to-person transmission in 4 countries: the United States, Germany, Japan, and Vietnam. The committee concluded that there was adequate evidence to classify this disease outbreak as a public health emergency of international concern. I want to reiterate that the essence of this classification is to help member states strengthen their preparedness and response capacities to deal with preventing and controlling this outbreak. This classification is largely about controlling the spread of the virus and the disease it causes. The committee acknowledged the good work done in Wuhan and in other Chinese provinces to arrest the spread of the disease and indeed to contain the disease from spreading outside of China. However, the committee believed that there was room for a more coordinated international response to this situation. The committee also emphasized that they believe it is still possible to interrupt the spread of the virus, provided that countries can put in place strong measures to detect the disease early, isolate and treat cases, trace contacts, and promote social distancing commensurate with the risk of disease. We are working with the Department of Health and the Philippine government. As Dr. Domingo just mentioned, I will be attending the high-level meeting of the intersectoral agencies to see how better we can support the DOH and the government of Philippines in its efforts, recognizing that you already have one confirmed case and several persons under investigation. WHO remains committed to help preventing the spread of this virus and to mitigate its impact on the Philippines and other member states, and is mobilizing all its resources across country, regional, and headquarters levels to facilitate that process. We are also working together with the government of China through the sending of teams of international experts, as agreed with the Chinese government, to facilitate a better understanding of the disease, to understand better the measures that are being implemented in China and how they can be translated into other countries who have significantly different capacities. So, I want to reiterate again that here in the Western Pacific region and globally, WHO is committed to help all member states, irrespective of their capacities, to prevent and control the spread of this virus and the disease it causes. Thank you.
Napanood po natin ang update ng DOH sa 2019 novel coronavirus. Kinumpirma nilang 29 pa rin ang persons under investigation para sa nCoV. Kinumpirma rin nila ang pagdedeklara ng global health emergency ng World Health Organization ang dahilan ng travel ban sa mga galing ng China sa bansa. Muli nilang pinaalala sa publiko ang precautionary measures gaya ng kalinisan, pagpapalakas ng resistensya at pagsusuot ng protective gear lalo kapag nasa ospital.
Sabi naman po ng World Health Organization na karamihan pa rin ng mga kaso ng nCoV ay nasa China. Pero kapuri-puri naman daw ang ginagawang mga hakbang ng nasabing bansa para kontrolin ang sakit. Pinakiusapan na lahat ng member states na tumulong sa pagsasagawa ng mga hakbang para mapigilan ang pagkalat pa ng virus. Kabilang sa mga hakbang na ito ang pagsasagawa ng contact tracing sa mga pasyente. Samantala, kakapasok lamang po na balita, kinumpirma ng DOH sa press con ngayon lang na 31 na ang persons under investigation o yung mga inoobserbahan dahil sa posibleng nCoV infection.
2 raw ang additional cases, Mayan, pero hindi pa kinumpirma ng mga otoridad kung saan ito naitala.